Hi, my name is Kyra McCoy, and I am the Director of the Nursing Programs at Edmonds College. This presentation will provide information on the requirements for students to go to clinical. In Washington, the state requires at least 300 hours of clinical experience to graduate and become a licensed practical nurse, and 500 hours to become a registered nurse. To complete the required hours, a student must meet the requirements discussed in this video. We often refer to these as a clinical passport, or your ticket to go to clinical. General categories of documentation needed for the clinical placement include national and state background checks, documentation of immunizations and TB status, CPR certification, and a urine drug screen. Requirements for caring for people in healthcare settings are imposed by state law and individual facility policies. We have no control over them. We use an online document service for students to upload and store documents for their clinical passports. Students receive instructions on how to get an account with this service after everyone has accepted their admission. There is no need to purchase an account prior to that time. However, it is a good idea to start on your requirements before then, as we must have all documentation in by the first week of the quarter for you to remain in the program. Some of the immunizations can take almost 8 months to complete, so an early start is highly recommended. When a student signs up for an account with the online document service, the company completes all required background checks. Nurses care for vulnerable populations, and the state must ensure that our students don't have a record that could put their patients at risk. There is a list of Department of Social and Health Services, or DSHS, disqualifying crimes on our webpage. If you have anything on your record that is on this list, it may keep you from remaining in nursing school, so please check this if that is a possibility. Skilled nursing facilities also require a DSHS background check, which covers not only convictions, but also charges and other items like CPS and fraud reports. Clinical sites can deny placement based on their own criteria. We have no control over this. So if you have anything on your background check, please disclose it to us so that we can work with you. You must have documentation that you do not have active TB. This is most often done with a skin test, also called a PPD. You must have documentation of your initial 2-step PPD and your annual follow-up tests. If you don't have this, you will need a new 2-step test, which takes 2 to 3 weeks to complete, so start early. If you were not born in the U.S. and have had the BCG TB vaccine as a child, you should not have a skin test. You have 2 alternatives. Submit a clear chest x-ray report or a negative quantiferon gold blood test. The TB status is updated annually, so you will either have to have another skin test or a blood test for the second year of the program. Students are required to be immune to certain communicable diseases to protect the patients they care for. Those are listed on this slide. For hepatitis B, this is as much for the students' protection as it is for the patients. This vaccine series consists of 2 or 3 injections over a 6-month period, depending on the vaccine you receive, followed by a blood draw for an antibody titer 6 to 8 weeks after the last dose. So this is 3 vaccines and a positive titer. For varicella, which is chickenpox, and measles, mumps, and rubella, students need either proof of a 2 vaccine doses or a positive titer. Students must have an influenza vaccine annually in the fall, so you will need 2 flu shots during the program. Students should also be immunized for COVID-19. Many of our clinical partners require students to be vaccinated against COVID-19, and some even require boosters. There are facilities that will accept a waiver for medical or religious reasons, but many don't. Again, we have no control over this. If you are not vaccinated, we may not be able to place you at a clinical site. If you do not complete the hours of clinical time required by the state law, you will not be eligible to graduate and get a license. We want you to make an informed decision before you start the program. All students are required to be certified in cardiopulmonary resuscitation, or CPR. We require American Heart Association Basic Life Support, or BLS. We will accept a certificate from your job if it is AHA BLS. Courses are also offered at the college and are available locally. You cannot take a fully online CPR course to meet the requirement. CPR certification lasts for 2 years. Some of our clinical partners require a negative drug screen. Even if a drug is legal in Washington, such as cannabis, a positive drug screen will prohibit you from attending clinical. Some prescription medications, such as ADHD meds, anti-anxiety drugs, or antidepressants, may show up on the urine screen. If you take these medications, you will provide documentation of a valid prescription and you will be fine. The best way to contact anyone in the nursing department is by email. There is also much more information about this program, including other videos, frequently asked questions, and an application on our webpage. You can also contact our program support staff. Our nursing navigator is Julia Erickson, and our administrative staff is also listed here. Please understand that the information in this video is a requirement for completing this nursing program or any other nursing program in the state of Washington. We have very little, if any, ability to make exceptions. We're glad that you will be joining us in our Edmonds College Nursing program. I hope this information in the presentation was useful, and I look forward to meeting with you soon.